lot of my research is to do with these kind of big data sets and analysis of these big data sets. So the papers that you're mentioning specifically look at which participants will improve under which conditions. So with this particular project, it's called the Release Project. What we did was we looked at the individual participant factors that predict recovery. We looked at the therapy factors, and that includes, how many hours do they get, how much intensity, how frequent is it per week, and what is the total duration of the therapy that they get, and what impact does that have on people's outcomes, and how does that therapy tailoring impact specific types of participants, so the very young, the much older, different levels of aphasia severity starting off as well. So what we've done with these large databases is really add power to the research landscape just now. So we've not analysed data just on one cohort from one country. We've really spread it wide and looked at 174 data sets. On top of that, a lot of my research looks at standardizing outcomes, and this is a problem when you're using big data sets because lots of different researchers use different assessment tools according to what's available to them in their country, what language translations are available, and also the needs of their individual research. So what that means is when we put all these databases together or data sets together, there's lots of different types of outcome assessments, and it poses a problem because there's a very little overlap in what people are using. So it makes it very, very difficult to aggregate all the data together and to analyse it in a way that's going to be meaningful for the patient in front of you. So a lot of what I do is to work on recommendations to standardise how we're collecting data. So with my colleagues, with the collaboration of aphasia trialists and my colleague Sarah Wallace, who is from Australia, we developed the Describe checklist, which is a participant descriptor checklist for use in future aphasia studies. So it basically says if you're going to do a study in the field of aphasia, we recommend that you collect these specific participant factors so that going forward, new research will all be collecting similar data. And it means that we can aggregate the data together and have a lot more power when it comes to analysing the data as well.